I'm Dr. Alexander Roedlach, a medical anthropologist at the Department of Cultural and Social Studies at Creighton University. As a medical anthropologist, I'm exploring issues at the intersection of healthcare, volunteering and religion, but I'm also interested in issues related to homelessness, particularly issues related to the health of homeless populations. Sometimes we assume that the homeless are on the streets because of bad choices they made. And of course, individual responsibility is important to consider when we talk about homelessness. But as the social sciences clearly show, homelessness is also the result of social and cultural factors, as well as policy issues, which have to be explored in order to understand homelessness. For instance, in the 1980s, there was a massive increase in homelessness because of policy changes. Subsidies for low-income housing were either reduced or eliminated, making it more difficult for low-income earners to stay in their homes. At the same time, programs provided grants for owners of houses to remodel and upgrade them. And this, of course, also increased the rent for these homes, making it even more difficult for the low-income individuals to stay. And it drove many people, many families onto the streets. At the same time, in the 1980s, we had an increase in inflation, which devalued the grants which people at risk for homelessness could receive. The money was just worth less. As we know, the homeless face a disproportionate level of the burden of disease. For example, some studies indicate that about 40 or even 50% of the homeless face and experience and suffer from tuberculosis. Particularly vulnerable are homeless women. Some studies suggest that between 15 or 35% of homeless women have experienced some form of physical abuse, including rape. And particularly vulnerable are homeless children. In one study, half of homeless children face the threat of asthma, much more than children in the general population. Now, we could say, why should we care? It's their own fault. We're on the streets because of bad choices we made. But as I indicated, social and cultural as well as policy issues are responsible. Therefore, we should feel responsible for them. And sometimes we should feel responsible out of mere, pure, selfish reasons. For example, if many homeless are suffering from tuberculosis and we don't live in a bubble, we also are exposed to the risk of tuberculosis. Similarly, when we understand the factors exposing people to a higher risk of becoming homeless, we also could become homeless at one point in our life. Therefore, being nice to them will make it possible that someone might be nice to us when we become homeless. St. Ignatius of Loyola, the founder of the Jesuit order of priests and brothers, coined this phrase, "Go and set the world aflame." It means for us at Creighton University and also for others that we should use our God-given talents, the skills we learned, to make a positive change in our society, to work towards a society where everyone has the same chances and everyone, including the homeless, can fulfill his or her potential.